Hi.
I'm Brooke.
Nice to meet you.
Nice
Brooke.
to meet you. How are you?
Good. How are you?
Good.
So tell me about yourself.
So I recently just graduated from Carson-Newman University. It's a school in Tennessee. I was out there because I played softball, and they gave me a scholarship. So it kind of just all really worked out for me to get the awesome opportunity to become a nurse. I am moving back here to California so that I can finally just get my foot in the door and hopefully find a position somewhere where I can be for a while, and just waiting for that experience, I guess.
Okay.
Yeah.
So why this hospital?
So I have grown up around here in the Bay Area. I've drove by the hospital before, and not really knowing what the hospital stood for, I went away for school and became a nurse. And now that I've come back, I really feel that the mission of the hospital fits with the nurse that I want to be and the person that I want to be for families that I come into contact with here. So I really think that I can be somebody that benefits from being here with my learning, as well as somebody that can help other families benefit from the hospital. So.
Okay. So why this floor exactly?
So I've always had a passion to be a neonatal nurse. I hope that after I get some years of experience that I can go get my master's. That's really just been my plan. I have some personal experience of family members having children that have had to be in the NICU, and just seeing what the nurses have had to do to not only help my niece and nephew, but be there for my sister was something that I feel I could fill a position really well, as well as just something I feel like I have a calling for. So that's pretty much.
Okay.
Yeah.
So what would be one of your strengths?
I think one of my strengths is that I want to know more. I always want to know more. I want to be able to do more. I want to be able to say that I did something that made a difference. So, I like to take the initiative to do research. I do come from a school that is really into evidence-based nursing practice, and so that's been something that has been put into just the caring portion for patients. I really like to make sure I'm giving them the best care, and I think that comes from doing research and really just being as involved with your patients and what's going on with them as much as possible. I think that is something that I'm really hoping is my strength that people see in me, and that continues to be a strength for me. So.
Okay, so what would be one of your weaknesses?
I think one of my weaknesses is that I have not developed with enough experience yet the time management that I want to really have. I am organized with the things that I do, and I am very, I like to check things off my list and make sure I've done everything and I've done it right. But since I haven't been able to have that experience yet, I think that is something I want to develop on. I have been able to have awesome preceptors that have allowed me to take on some of their patients, and with guidance from them, I've gotten a foundation of how I want to organize myself as a nurse. But I think that with the first month on the floor here and with orientation here, that I would be able to improve that so much more. And I think that's something that I know I want to work on as a nurse. So.
Okay. So where do you see yourself in 3 years?
Well, I definitely see myself being, hopefully, where I am after I graduate. So once I get my first job, I don't really want to jump around. I've been jumping around for college so many years that I just kind of want to be in one place, and once I get my roots into one floor and I really get the relationships with the nurses around me and the families that are coming through and the doctors that are coming through, I think that's really important to provide the best care for your patients. Just having an interconnection that is strong between everyone that's around them. And I think that comes with being there multiple years, not just being there for a little while at a time.
So if you see something going on in a hospital that you disagree with, how would you handle that situation?
If I were to see something that I did not agree with, in the sense that if it, I was witnessing another nurse doing something I didn't agree with, I would definitely try to talk to that nurse first, hoping that I could come to them as a fellow worker, as a fellow nurse, and be able to just have that conversation to hopefully kind of dismiss it there, let them know that somebody's seen it, and that's kind of not the way that the hospital likes to do things. But I would let them know for sure that if it were to happen again, if I were to see it again personally, it'd be something that I'd have to bring to the attention of the nurse manager or whoever's on at that time that can handle that. So just leave that to them. That's not for me to necessarily handle as much past just letting them know, that someone saw it.
Okay. So how would your classmates describe you? No, that was before.
Okay, sorry. I think that my classmates would describe me definitely as a leader. I have had experience for the past 2 years, or last 2 years of the nursing program, to be the representative for the class. That means that I attended meetings with faculty and other students. We came to common grounds about policies and just kind of handled things within that meeting. So I really was able to bring the concerns of the students that were in my class to the faculty so that they know just kind of what's going on. I really do like to be an advocate, and I think that's something that my fellow students saw, that I really did care about my patients, and they came first in pretty much everything I did. So, yeah.
Okay, so how have your educational and clinical experiences, how have those prepared you?
I believe coming from a school that is very evidence-based and into research, I've developed the skills to do proper research, so I can look into things, making sure that articles are trustworthy, finding the right information and bringing that forth. I think that is something that I learned from this school. Also, our program is very enlightened. They like to teach you as much as they can teach you, so we got a lot of knowledge being at this school, and I think that my BSN degree was well-deserved educationally, and I think that I possess the ability to understand greater knowledge because I came from a school like this. And then clinically, our school's given us so many opportunities, not only to be on different floors. I've done, obviously in the pediatrics, I've been on the NICU floor already within one of my clinical rotations. I've also taken a course that has been towards just the care of the high-risk neonate. And then, so when we were in our last semester, we also got our preceptorship, which is 92 hours. Sorry, it's one of those. But 192 hours where we really get to take on the responsibilities of a nurse, as a nurse in the field, and get to develop those skills, getting more hours than the nurses that do in other programs. We are one of the programs that offers 2 different types of preceptorships for those amount of hours. So I think that has really prepared me to come onto the floor confident to learn, and then to definitely apply the knowledge I already have, and hopefully help everybody else out on the floor as a nurse. So.
Yeah. So, very briefly, how would you describe your nursing philosophy?
So I believe, one thing I believe in is health, being on a continuum. I believe there's so much more to health than just, are you sick or are you not sick? I believe there's a holistic approach to things that we have to take on as nurses. I believe in the mind, the body, and the spirit. So I came from a school that brings religion into things, and I've taken, we've had clinical time where we've spent with people and actually have talked to them about their faith, and been out into the communities where faith-based faith-based programs have been put into work, and just seeing that, I believe as a nurse that you really should take every person individually as they are with their own set of circumstances, regardless what it is, and be able to just apply the best care that you can, compassionate care that you can, knowing that they may not receive that anywhere else. So that's really my philosophy.
Okay, so why should we pick you for this floor? What would you bring to this floor?
So I believe being a college athlete and having played through high school, I've developed real good teamwork skills. I'm able to lead if I need to take the leadership role. I'm also able to follow if I need to be somebody that has to learn and absorb, and that is absolutely fine with me. I'm into my learning, and I really want to be able to take initiative in the nurse that I'm going to be. So I take my work serious. I take my learning serious. I take my patient care serious. I really love the people I take care of. And I think that that is something that should be brought forth to every floor by nurses.
Okay. So do you have any questions for us?
So a couple of my questions, I saw that you all work in the communities. So I just wanted to see, are there any programs that me as a nurse I can help in? I'm just interested in stepping out of the realm that I'm, applying for and seeing if I can be helped anywhere else within the hospital.
Okay, so yeah, we offer a lot of different community resources for you to be able to get involved with. There's this resource and this resource and blah, 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 blah. Beep, beep, beep. Okay, do you have any more questions?
Also, I was wondering, I value time with my family. I value time in the hospital. How flexible is your floor? How well does the floor just flow? Does it work well? Are nurses, available?
Yeah, so our floor is very flexible. If there's obviously a requesting time off form. I don't know anything about this question.
I didn't mean to ask.
But this is good question.
Okay.
Any more questions?
No, I believe that's everything for me.
Okay, well, it was nice to meet you.
It was very nice to meet you.
We'll get back to you.
Okay, thank you.